Case study number 9. Summary. David Brown, a 45-year-old male. David presents with acute onset of severe headache, dizziness, and vision changes. He has a history of hypertension and smoking. Current situation. David arrives at the emergency department with a sudden, severe headache that started 2 hours ago, accompanied by dizziness and blurred vision. His vital signs are: blood pressure, 180/110ths of a millimeter of mercury. Heart rate, 95 bpm. Respiratory rate, 18 breaths per minute. Temperature, 37.0 degrees Celsius, 98.6 degrees Fahrenheit. Oxygen saturation, 96%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Subarachnoid hemorrhage SA. SA is bleeding into the subarachnoid space, often due to a ruptured aneurysm. Pathophysiology involves the sudden increase in intracranial pressure due to the presence of blood, leading to irritation of the meninges and brain tissue. Key points include early recognition, emergency intervention to control bleeding, and preventing complications such as rebleeding or vasospasm. Answer B. Hypertensive crisis. This is a severe elevation in blood pressure that can lead to end organ damage. Pathophysiology includes a rapid increase in blood pressure causing damage to blood vessels and organs. Important considerations include the immediate reduction of blood pressure to prevent complications such as stroke, myocardial infarction, or renal failure. Question 2. What immediate nursing care is required for this patient? Answer A. For subarachnoid hemorrhage SA, maintain airway, breathing, and circulation ABCs. Administer oxygen to maintain saturation above 94%. Prepare for urgent neuroimaging CT scan or MRI. Monitor neurological status and vital signs closely. Provide pain relief and administer antihypertensive medications as prescribed. Educate the patient and family about the importance of early intervention and potential outcomes. Answer B. For hypertensive crisis, administer antihypertensive medications to lower blood pressure gradually. Monitor vital signs frequently. Provide oxygen if needed to maintain oxygen saturation above 94%. Educate the patient about the importance of adhering to antihypertensive medications and lifestyle modifications to manage blood pressure. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. CT scan of the head, to detect intracranial bleeding or other abnormalities. MRI of the brain, to provide detailed images of brain structures and assess for stroke or hemorrhage. Lumbar puncture, to analyze cerebrospinal fluid for blood if SA is suspected but not confirmed by imaging. Electrolyte panel, to assess for any imbalances that may contribute to symptoms. Complete blood count CBC, to assess for infection or other underlying conditions. Coagulation studies, to evaluate the patient's bleeding risk. Electrocardiogram ECG, to assess for cardiac involvement, especially in hypertensive crisis. Medication information. Antihypertensives, for example, labetalol, nicardipine. to lower blood pressure and reduce the risk of further bleeding or organ damage. Considerations: monitor blood pressure closely and adjust dosage as needed. Educate the patient on the importance of managing blood pressure. Side effects: hypotension, dizziness, bradycardia. Contraindications: severe bradycardia, heart block without a pacemaker. Analgesics, for example, acetaminophen, to relieve headache pain. Considerations: monitor for effectiveness and educate the patient on proper use. Side effects: hepatotoxicity in high doses. Contraindications: severe liver disease. Calcium channel blockers, for example, nimodipine, to prevent vasospasm in patients with subarachnoid hemorrhage. Considerations: monitor for effectiveness and blood pressure. Educate the patient on potential side effects. Side effects: hypotension, bradycardia, headache. Contraindications: severe hypotension, known hypersensitivity. Anticoagulants, for example, heparin, to prevent clot formation if a secondary thromboembolic event is suspected. Considerations: monitor coagulation parameters and for signs of bleeding. Educate the patient on bleeding precautions. Side effects: bleeding, thrombocytopenia. Contraindications: active bleeding, severe thrombocytopenia. For fluids, for example, normal saline, to maintain hydration and ensure adequate circulation. Considerations: monitor fluid status and electrolytes, adjust infusion rate as needed. Side effects: fluid overload, electrolyte imbalances. Contraindications: severe hypernatremia, severe fluid overload.